Good evening, and I welcome you to your transformative program, Politics and Beyond. I'm your regular host, Emmanuel, Jr., and as I keep saying, it is always a delight to come your way every Monday evenings between the hours of 8 and 9. And it is just for a particular reason. And the reason is that we get the opportunity to discuss how best we can transform Ghana. This is a platform that discusses issues, topical issues, having in mind the interests of Ghana and just Ghana only. As always, you can get interactive with us using our social media platforms as you have it on the screen, including the WhatsApp line that will be exhibited on the screen. Share in your comments, share in your questions, and then at the right time, as we always do, we will share, we will read them, and then we'll have a conversation on it when the need be. This past week, a number of things have happened in this country. One of it got to me this morning, and that really happened yesterday evening. And this morning I woke up to a very sad story, and that has to do with the death of our own uncle, brother, comrade, friend, Ambassador Sampi Yali. This is a man I have known for years, and it's a man that I have always said is one of the few individuals who will always have my back. I remember having conversations with him as often as I can, and sometimes he will call me to check up on me and will always tell me where we went wrong and where we didn't go wrong, particularly when it has to do with sensitive conversations that is of interest to him on this platform. He has always contributed to this platform. I remember one of the days he had, a bit of heated conversation through his text message with one of our guests that we hosted here. And the last time I met him was about 2 weeks ago when we were both guests on a TV program on one other TV station, a Saturday program. And little did I know that that was going to be the last time I'll be seeing him. In fact, waking up today, I felt so bad, and I recalled one thing, and I want to share with you. Life is so short. You don't know what tomorrow brings. Do good when you can, and be at peace with anyone and everyone you encounter. You will meet someone today, and you may not know, but probably that might be the last time you meet a person. I want to use this opportunity to, on behalf of my team, on behalf of you, my viewer or viewers, on behalf of everyone, to express our deepest condolence to the family and friends of Ambassador Sampi Yali. We are with you in spirit, we are with you physically, and we believe strongly that together we'll be able to give our uncle, our brother, our friend, our father, our comrade, a befitting burial when the time is up. My condolence to the family. Now, having said that, we want to also bring back to the discussion what we are going to have this evening. There's one area that a lot of people do not consider so much, but it's very key. It's an area that affects you and I. It affects our life so much. So much. But most of the time, we don't give it attention. Probably because we don't see the importance of it. We don't see how it is so connected to our lives, particularly our existence as human beings. And I'm making reference to the issue of water, the issue of sanitation and hygiene. I have been told by experts that sanitation and water are best described as Siamese twins because they go hand in hand. But interestingly, it is one key area that we don't often give attention to, and that's why this evening I want us to dwell a bit more on it because it affects our lives, it affects your life, it affects my life. There are some few things that I want to bring to your attention before we even take our quick break. Are you aware that in Ghana, as we speak now, statistically 76% of households in Ghana have drinking water that are contaminated with fecal matter that leads to waterborne diseases like cholera and typhoid. That is something that a lot of people have not given attention to. 40% of the urban population in Ghana lacks access to clean and quality drinking water, with sporadic supply in urban neighborhoods, forcing households to rely on unsafe sources. The third one that I also want to bring to attention is that just about 25% Ghanaians have access to improved sanitation facilities, with 81.6% of households using unapproved or unimproved toilet facilities. It is alarming. The other one is that 15.2% of households in Ghana do practice open defecations, and this contributes to environmental pollution and water resource contamination. 15.2% of households in Ghana practice open defecation, and that is really alarming. Diarrhea diseases in Ghana causes 19,000 premature deaths annually, including 5,100 children under the age of 5, caused by diarrhea. And the other one that is also risky, and a lot of people don't know, is that sachet water, it may, and the operational word here is may, be contaminated with substances that can cause kidney damage or increase the risk of kidney stone formation. These are some of the things that we close our eyes on and we don't even look at. And that's why this evening it is important for us to bring to our attention the issue of water, the issue of sanitation, and the issue of hygiene. We are going to take a quick commercial break, and when we come back, I will introduce to you the topic that we are discussing, but it centers on these three areas: water, sanitation, and hygiene. And we are also privileged to have someone, one of the best persons you can have when it comes to this topic or this area. When we come from the commercial break, I will introduce to you the guests that we have this evening, and we'll zoom right into the conversation. Stay tuned.
Should have at least 60% water for optimal performance in any physical or mental exercise. We can help you maintain it naturally. Natural mineral water. Simply natural. For bulk purchase, call 0596-273-546 or 0596-273-547. This advert is FDA approved.
Just some naba. Now some in a TVXYZ. Yes, so ton do your business. Another product. TVXYZ. And you recount me am no akweja to my ton and paying a pabazi. A great opportunity. Yes, my young customers, clients. I am viewers now. Ton who is your business, your product now. The TVXYZ viewers. What does papa? Neither befriend 0533-825870 0533-825870 Mayenzi komone yambu na tanwo anade botuma XYZ na himfia you will so abebrese street brana yambon komo take the opportunity na tanwo ho XYZ marketing promo na together we make it happen tanwo ho with TV XYZ to do.
Welcome back. You are still with your transformative program, Politics and Beyond, and I'm your host, Emmanuel Jr. As I indicated earlier before going on the break, we are having a conversation on water, sanitation, and hygiene situation in Ghana. And we are asking ourselves whether we are in a crisis or we rather should see it as a prospect. This evening, we are going to have this conversation with a brother, a friend, a specialist, someone who is really an expert when it comes to this area. And I'm making reference to Mr. Yao Ata-Ahin, who is the WASH technical specialist at the World Vision Ghana. And he is also the former chairman of CONIWAS. Mr. Ahin, welcome to Politics and Beyond.
Thank you, my brother.
I hope your day was good.
Great.
Nice one. Nice one. Good to see you too. Good to see you too. Now, quickly, what does CONIWAS represent?
Oh, CONIWAS is, first of all, let me say good evening to our viewers.
Yeah.
CONIWAS simply stands for the Coalition of NGOs in Water and Sanitation. Yeah. So it's an umbrella body of all NGOs into water and sanitation in Ghana. Yeah.
I remember some years back there was this man, Nana something. He had an NGO called Friends of Water Bodies. Is he still around?
I am not too sure.
He's one person who really started the advocacy,
especially when it comes to water resources.
Exactly.
And the protection of same.
Exactly.
He really did a good job.
He did a good job, and he's one person that I believe we should find and then award. I mean, I haven't seen him before. Very, very passionate. And what is interesting is that when he started this advocacy, a lot of us, including me and a lot of Ghanaians, I believe, didn't even realize that the issue of water was so important. He was the first to predict that very soon Ghana will be importing water into this country. And somewhere last year, early this year, last 2 years, when the issue of Galamsey became so serious, people were predicting that very soon we are going to have, how do you call it, crisis on our hand and all that. But tell us, what is Ghana's water situation like?
All right, so first of all, let me indicate that water is life, as we all know. And there is virtually nothing you can do without water.
Yeah.
In fact, the UN General Secretary or Secretary General, Antonio Guterres, has indicated during the last World Water Day, he made a very profound remark. He said that water is the lifeblood of our world. From health and nutrition to education and infrastructure, water is vital to every aspect of human survival and well-being, and the economic development and prosperity of every nation.
That's right.
And so there is virtually nothing you can do without access to safe drinking water. In fact, it is said that no strategy for poverty reduction can ignore people's vital requirements for safe drinking water. And I add, and sanitation. Yeah, because these are fundamental to health, fundamental to education, poverty reduction, socio-economic development. And so for me, it should rather be the fulcrum around which all development must revolve. Unfortunately, it appears that we don't prioritize it enough. And we haven't invested adequately into the delivery of safe drinking water. And that is why we are where we are. In fact, as a country, we have done well. Currently, we are at 87.7 according to the Population and Housing Census 2021. 87.7 is not bad.
That's percent.
Compared to percent. Here we are talking about basic access. Basic meaning that people spend 30 minutes. A round trip will take you 30 minutes to get access to safe drinking water. Beyond that, we don't classify it as safe or improved. When it comes to safely managed water services, where it is piped to the premises, where it is available when needed and free from any contamination, we are at 42%. And that compares favorably with the sub-Saharan African average of 30, but way off target when it comes to the global average of 74%. And so there is a lot that we can do. And I say that if we redouble our efforts and invest a lot more, and prioritize the delivery of safe drinking water, Ghana should be able to achieve the Sustainable Development Goals for at least water.
How do you link it to our water bodies? Because primarily we get water, one of our main sources has to do with the water bodies, right? Now, over the past period, there has been this issue of galamsey messing up our water bodies.
Yeah.
Does it have a direct effect on the quality, especially the quality of water we get?
Definitely. You know, Ghana is blessed with so much water resources. In fact, we have in excess of about 53.2 billion cubic meters of fresh water resources.
Oh, okay.
And therefore, if we're managing it well, we are not likely to face any challenges in the future. However, given the way we are polluting these water bodies and many of them drying up and being dead, it is a worry. It is a major source of concern. There is a direct link between water resources, the raw water, and then the treated water. Of course, when it comes to urban water, you know that we rely almost solely on surface water.
That's right.
And that is the water resources that are being polluted. That is where Ghana Water Limited will get their raw water intake and then process, treat, and then distribute to our households. Even for groundwater, there is a direct relationship between the quality of surface water and the quality of groundwater, because there is that engagement among the two. And so it's important that we pay attention to surface water, groundwater, and that is how come we'll be able to get increased access to safe drinking water.
What about rainwater?
Rainwater has a bearing too, because the runoff has impact on both surface water and then also groundwater. And so when it rains, there is an impact on both surface water and then also groundwater. And so we should be able to have a holistic view of water resources, whether it is surface water, whether it's rainwater, or whether it's groundwater, because the impact is huge when it comes to the delivery of safe drinking water.
We've talked about, well, before we even go to there, let's dwell a bit more on the rainwater. I know of individuals who just harvest the rainwater and consume it. How safe is that?
Naturally, rainwater is safe when it's coming directly from, let me say, directly from heaven.
That's right.
So, but you see, it will come into contact with so many variables, including the roofing systems, so many things, and that is why it will get contaminated. And so it will not be very safe to just drink rainwater directly. At best, you may want to purify it by taking it through a certain process. We have a rainwater harvesting strategy as a country. Very nice one, but it appears we are not even implementing it. It was developed as far back as 2011 there. Very fantastic document.
You want to take us through it briefly?
Yes.
What does it say?
So what it says is it gives you the parameters for harvesting rainfall, where you can harvest, and all the technical calculations and computations that go into harvesting rainwater, especially in institutions, schools, healthcare facilities, among others. But very little is implemented. Even at the household level, it gives details about how you can collect and store rainwater. And so it's a very fantastic document, but I think we haven't implemented it well enough.
What is causing it?
That has always been our challenge.
Right. We always have the ideas, the implementation.
Yes, the lack of implementation.
We're limiting it to this particular one. Whose duty is it to ensure that we implement whatever
this one
we have
is directly under the Water Resources Commission. It was developed under the ambit of the Water Resources Commission. And so perhaps you will expect that commission will also lead the process of getting it across the country through the Ministry of Works, Housing and Water Resources. Maybe it's time to trigger that discussion so that as a country we can also take advantage of rainwater harvesting.
I agree. I want us to look at, even though we are still talking about water, I want us to tie it in with sanitation.
Sure.
We've always, and indeed, I first heard of it from you and later from others, describing water and sanitation as Siamese twins.
Yes.
What does that mean?
Yes, it means that, water and sanitation are enablers. The two are enablers. They are a catalyst for growth and socio-economic development.
Right.
I mean, you can't have one and leave the other if you want to have the full benefit of that package. Because if you have water and your sanitation is poor, you will suffer. You can also have improved sanitation without good water. And that is why we say the two, I mean, are bedfellows.
That's right.
They go together. And that is why we have combined them in our work. And we have added hygiene. Because when you have the three, the potency of the three is so much. It gives you good health, quality education, poverty reduction, and socio-economic development.
Look at what we talked about, where we said diarrhea takes a number of lives.
Yes.
Diarrhea can be attributed directly to issues bordering on sanitation.
Perfect.
What is Ghana's sanitation situation like?
So, like you said, I mean, there's a direct connection between poor sanitation and health.
That's right.
I mean, maternal and child health particularly. Unfortunately, even though we have done quite well in terms of access to safe drinking water, we have performed poorly or abysmally when it comes to the delivery of improved sanitation. And so, for example, globally, yes, there are challenges everywhere. Globally, almost 3.5 billion people lack access to safely managed sanitation.
3.5 billion.
3.5 billion safely managed sanitation.
Okay.
In fact, about 1.8 billion suffer from basic sanitation. And then also almost 1 billion practice open defecation. So globally, sanitation is a challenge. When you come to Ghana, we have 25.3%. So let's say a quarter of the population.
The population, yeah.
Having access to basic sanitation. And here you are talking about toilet facilities. So in other words, only 25% of the population has improved toilet facilities that they can call their own, that they don't share with anybody. As high as 55% plus share toilet facilities. And 23%, I mean, patronizes the public toilets.
23%?
Yes, 23%.
Ghana's population?
Yes. So
That's
when they
alarming.
wake up, they have to go to the public. They don't have one. And they also don't want to practice open defecation. At least that is better than
That's even better.
those who
I
practice
agree.
open defecation.
I agree.
But there are issues with public toilets. I mean, the safety issues and the comfort, the convenience and all that. Apart from that, you have 17.7% of our population practicing open defecation. So when we say 17.7, it may look, sometimes it may look small, but you are talking in excess of 5 million
5
people.
million Ghanaians.
You have 5.4 million Ghanaians.
Wow.
Or residents of Ghana who practice open defecation. And it will surprise you to know that whilst the national average is 17.7, we have regions such as Savannah, which has 68.5% of the population practicing open defecation.
So they go to the bush.
They go to the bush, any open space, wherever they will find. And then for Upper is 68.4.
Wow.
And it's a major worry. And it's a worry because, you see, a UNICEF study has revealed that just 1 gram of human feces, and I don't know whether I can show you what 1 gram is. 1 gram is just like a paper clip.
Right.
Very
minute, yes.
Because 1,000 grams make 1 kilogram.
That's right.
So when they go to the market and buy 1 kilo of meat, you divide that into 1,000 before you get 1 gram. That's
so
1
just
gram.
1 gram.
Just 1 gram can contain 10 million viruses.
Wow.
1 million bacteria. Wow. Thousands of parasites and disease-causing germs, X. And so it is dangerous. And that is why it shouldn't come into contact with a human being. Unfortunately, because of our high open defecation rate, children are getting sick, they are dying as a result of diarrhea, cholera, and such other diseases. Apart from that, you mentioned in your intro the effect on drinking water.
Drinking water, exactly. Yeah.
There's a high correlation between our open defecation rate and the quality of drinking water. And so the multiple indicator cluster survey of 2017-2018 indicates that 5 out of 10 point sources, when I say point sources, I mean the boreholes where people go and fetch, or the standpipes,
that's right,
are contaminated with E. coli. E. coli is simply fecal contamination. It means that feces have entered into the water, drinking water.
The boreholes.
No, when you go and fetch, yes,
exactly.
the boreholes, the standpipes, because of our high open defecation rate, because it will also seep into our groundwater. Apart from that, when they bring water to the household and they store it, based on how it is handled, 8 out of 10 household water is also contaminated with E. coli. And so some of the practices we engage in have direct effects on our drinking water and our health. Unfortunately, we have not been able to connect to know that these have high impact, and that is why we are still suffering from it. So for sanitation, the situation is quite poor. In fact, when you even go to our schools, 26% of public basic schools don't have access to a toilet facility at all. 26% of all public basic schools. So when the child goes to school,
so then how do
there's
they
no toilet facility? So either you practice open defecation around, or you have to go home to respond to nature's call. 26% don't have a toilet facility. Just for public basic schools. For private basic schools, it's better, but it's also about 11%. And so we have a situation on our hand, and we fail to realize that these things have impact on education.
That's right.
We think that education, or I mean, it's just the classroom, the slate, the chalk, no, and the teachers.
Yeah.
All these create the conducive environment for the child to learn and to study.
That's right.
Unfortunately, we don't pay attention to it. Even in healthcare facilities where people go for healthcare, there are several of them, about 25% don't have access to,
like clinics, community centers, hospitals.
Yes, chip centers. They don't have access to toilet facilities and all that.
But how can someone in this time and age build public facilities without...
That's also another major topic for another day maybe, because we have public institutions mandated to ensure that these things don't happen.
That's right.
And yet they happen.
Yeah.
In today's Ghana, there are schools that are built without a toilet facility. Shocking.
That's interesting.
Yes, even today. And I don't know whether people think that, oh, this thing, people can just handle it. And so they don't provide for it at all. And it's having a toll, not only on our health, but also on our education and our dignity as human beings.
Yes. But that's worrying. You made mention of...
we haven't even talked about public places like markets and
I was coming to those places to see.
People don't have toilet facilities. And so people go to the markets with chamber pots, with poly bags, and they do things around, and then...
And they are still selling.
Oh, yes, they are selling with careless abandon. And it is so shocking why we don't pay attention to these things. The recent cholera outbreak,
that's
you know how much we are spending on it?
No.
We are engaging in vaccination. We are doing public education. The minister is, you see him going around up and down. All the healthcare personnel are busy, and it's a cost to the state. Meanwhile, if we spend just a little to improve our water and our sanitation, cholera, diarrhea, and all those diseases may soon vanish, and we'll be safe as a country. You don't wait till there's a cholera outbreak and then you move around using vaccination. The other day, the minister for local government,
that's right,
chieftaincy and religious affairs, indicated, and it was a profound statement. He says the cure for cholera is not vaccination. It is safe drinking water, and improved sanitation and hygiene.
The preventive cost.
Yes, we don't pay attention to the preventive aspect. It's a public good, and everybody must be involved to ensure that we have a safe, clean, and prosperous country.
You've said most of the things, but there's one thing I want you, in very simple terms, I want you to let my viewers understand. When you refer to safely managed sanitation, what does that mean?
So when you talk about safely managed sanitation, just like we have safely managed water, you know, this is a situation, for example, in your home.
Yeah.
Just in simple terms, in your home, you have a septic tank. For perhaps you have a WC.
That's right.
You know that.
Yeah.
And so you can manage that facility in a better way. Okay, when it is full, it is evacuated from site and all that. When it is not safely managed, you can't have all this. You will not be able to manage it in a way that doesn't even come into contact with the human body. So it's not safely managed. It's just handled, I mean, in an unorthodox manner, just like people who are also practicing open defecation.
That's right.
It is not safely managed. But when it is safely managed, there is a process it goes through, even treatment, evacuation when it is full and all that, so that safety is assured.
It's assured. Whose duty it is, or which agency and institution in this country have the mandate to ensure that we have safely managed sanitation situation in this country?
So you can talk about a number of institutions.
Right.
First of all, the ministry.
In this case, Ministry of what?
Previously, Ministry of Sanitation. Water Resources. Now, it will fall under Ministry of Local Government,
right.
Chieftaincy and Religious Affairs. And then the ministry also has directorates. The Sanitation Directorate is under the ministry. And then you also have the district assemblies, MMDAs. Unfortunately, and it's one of the major reasons why the Ministry of Sanitation and Water Resources could not succeed.
Okay.
Because whilst you have the ministry, it lacked the operational agencies to be able to deliver effectively on improved sanitation. Right. So, for example, under Water Directorate, you had the Ghana Water Limited, you have the Community Water and Sanitation Agency, you have Water Resources Commission, you can talk about Water Research Institute and all that. So they are implementing the policies of water and all that. Sanitation didn't have any. So after the ministry, there were no agencies under that.
So it was just a ministry hanging,
not on the ground. And the argument was that, oh, the assemblies are there. But remember, the assemblies are there for every ministry, every sector.
That's right.
And so if you have your ministry and the ministry staff have to go down to the ground to implement, it's a difficulty. And so it wasn't surprising. I, for example, had made a statement that the establishment of the Ministry of Sanitation and Water Resources was meaningless unless it was linked with the establishment of a National Sanitation Authority or any operational agency. But once we didn't have that, I mean, the ministry was bound to fail, especially under the sanitation wing.
Aside having the agencies under the sanitation,
yes,
that is one major thing that has caused our downfall.
Yes.
Which what over the past have we done that has also not helped us?
Yes, so first of all, I will put it squarely on lack of prioritization.
Okay.
We have failed to prioritize sanitation as a country, right from the top to the ground.
Right.
Because even though technically you will find water and sanitation in all the national development plans,
right,
the blueprints, when it comes to implementing them, we have failed to prioritize. And that is why we are facing these difficulties. If we don't prioritize improved sanitation, it will always come back to bite us hard. Apart from prioritizing, there is lack of investment. We haven't invested in sanitation at all. I mean, if you look at the budget for sanitation over the years, you understand the point I'm making. Because if you fail to invest, there's no way you can reap the results. And if we had invested, by now you will expect that at least every district would have put in place all the necessary measures, mechanisms to ensure that open defecation is gradually being eliminated. There's increased access to toilet facilities at the household level, institutional level, and at the public places, markets, lorry parks, and all that. Once that happens, then you are getting rid of the preventable diseases like cholera, diarrhea, and all those ones. And apart from investments, we have also failed to enforce the laws and the bylaws that we have. And trust me, we have them. We have laws, we have bylaws. And our policies on sanitation are so good that other countries even visit us for learning tours and all that. And they go back with it. They change virtually nothing. And then they are implementing it. We have developed these beautiful, policies and plans. For example, the environmental sanitation policy.
Right.
Brilliant document. We have the what we call the rural sanitation model and strategy. And so we have the policies and the plans, but implementing them has been a problem. And so implementation is one of the factors that I'll talk about. And then the almighty behavior and attitudes. You see, we need behavior change in this country. We need to reawaken the consciousness of the citizen.
Right.
Our consciousness is so bad. Our orientation to sanitation is so poor that people don't seem to care at all. They think that why should I even bother when I'm building a house to even build a toilet facility in there? Because they can always find a place. And that is why we are where we are. And then maybe I want to say that as a country, we need to develop what we call comprehensive and sustained behavior change communication strategies. So we can continue playing it and it will sink.
That's true.
But if we don't we leave everybody to their fate, then we will continue to have these challenges.
The barriers you've just mentioned, there are two that is of interest to me: the enforcement, and then behavioral and attitudinal change. You see, these things, when these particular two areas, when I hear them, and not just in this field, but in any other field,
everywhere, yes.
We talk about behavioral change, we talk about enforcement. We are lacking the enforceability of laws. Ghana has all the fantastic laws, fantastic laws.
I agree with you.
But we lack the enforcement for it, even though we are paying people with our taxes to ensure that the laws are enforced. But I'm sure we'll get to that in a different conversation. But behavioral change, a practical example. When you go to Rwanda, Kigali, is it Kigali?
Yes, Kigali.
Yes. I'm told it's one of the finest or the cleanest cities.
One of the cleanest cities in
I encountered someone, and I was asking the person, is it that there's a law that says if you litter around, you'll be arrested? The person told me that no, he's not aware of any such laws, but just that the orientation right from childhood is such that you will not feel comfortable to even litter around. That's behavioral. But the other thing I saw, which was so interesting, was that almost every junction you get to, you see a dustbin. And so, in as much as we are calling for behavioral change, it is also important for the leaders to create the environment that will enable the behavioral change.
Perfect.
Don't you agree?
I agree with you. I agree with you. And for me, you can't just rely on behavior and attitudes. Because you see, everywhere in the world, if people had the opportunity to defecate in the open, they would do it. Even in the United States.
I agree.
If nothing will happen to you and you could just do it anywhere, you do.
That's right.
When people get to the traffic light and
Exactly.
they can cross, when they cross. But you cross at your own risk.
Exactly.
At a price.
That's
and so
right.
people will not dare do it. But here, it appears that the laws don't bite. It hardly catches anybody. Because definitely there will be somebody who will come to your aid, plead on your behalf, and then
it is gone.
You are gone.
So whose fault is it?
Yeah,
is it the citizens? Is it the leadership?
It's a systemic thing. But I think leadership is the cause. All other things are effects. And so I think that we should have that leadership that is bold enough and decisive and decide that this is the way we want to go. And as a country, we will chart that path. Yeah. That reawakening must begin now. Otherwise, it will deteriorate.
I agree. I mean,
yes, it must begin now. And I'm happy that the minister is talking about the National Sanitation Day coming back.
Exactly.
And I say it shouldn't just come back.
Yes.
It should come back in a different form and style. It should come back with a different objective. And the mentality of the citizens must change.
That's right.
So, for example, it shouldn't just be going out there to clean the streets every first Saturday of the month.
Yes, and that is it.
But our problems go beyond solid waste.
Sure.
I'm saying we should find a way to include liquid waste, ensuring access to household toilets, ensuring people don't defecate in the open, and all that should be part of this national sanitation campaign.
Why is it that over the past period, even till now, we prioritize solid waste?
Yeah. I mean, when you talk about
we talk about waste sanitation, the first thing is the solid.
I mean,
why is it so?
I mean, it has become our. It's because we also don't prioritize the liquid waste. We think that toilets. I mean, I can always find a place, and they see the solid waste.
Yeah.
And so what you see also has imprints on your mind. So maybe that is what also accounts for that. But I think that initiative is good. Then also he talks about the National MMDA Sanitation League.
Yeah, that's right.
Table, where you assess the assemblies regularly, and then those that are doing well in terms of improved sanitation, you reward them. Those that are not doing well, you sanction them. So I think if we are able to do that and do it well, it will go a long way to help us. But I think that let's have a national reawakening of our consciousness in terms of sanitation. It's so important, so important, because you see, there's an American philosopher in the United States, American philosopher, who said that even though we take it for granted, sanitation is a physical measure which has probably done more to increase human lifespan than any kind of drug or surgery. There is no drug or surgery that can replace the potency of improved sanitation in the lives of people. And that is why I think that we have to prioritize it, and prioritize it now. Citizens must begin to appreciate that there is a direct correlation between poor sanitation and health, poor sanitation and quality education, poor sanitation and income generation, poor sanitation and productivity, poor sanitation and socio-economic development. That link should be established. And once that is established and people understand, maybe they will begin to do the right things.
There's this tester. He says that, good evening, Mr. Wilson. The state of our water bodies has been destroyed by illegal miners. Even the color of Accra Sea has changed. I always wonder how people use our water bodies to do politics. And I'm Christian Ekwamwa from Odomechala in the Oti region of Ghana. Why do we? Because you see, this conversation, one thing that is so striking is the fact that even in this modern times, we are still constructing schools without toilet facilities.
Yes.
Obviously, we are still constructing markets without toilet facilities and all the other facilities that will help, prevent, or take care of the sanitation and all that. Do you think, as a country, we have failed to identify which areas we should see as a national interest area and we should approach it as a non-partisan area? Do you think the partisanship as a country has gotten into every fiber of our economy and society, that issues that should be of national interest we are not even seeing?
I agree with you 100%. I mean, our partisanship is destroying this country. In fact, I recall an incident where I was listening to radio, and the discussion was on access to safe drinking water.
Right.
And one caller said, I mean, I won't tell you when this happened.
Yeah.
Just for
Right.
security reasons.
That's right.
And one caller said, we need water in our community. Our children are dying. We don't have access to safe drinking water. We have to travel long distances even to fetch contaminated water. And the other person called and said, the government has done well. He has also done something. So you have to appreciate it. And I said, is it that that person doesn't need access to safe drinking water?
Exactly.
But why will you even bring in
the government? When we are talking of national issues affecting you as human.
So I was expecting that that person will also support and say, yes, it would be good to have access to safe drinking water so that the children can live long and have their cognitive development and all that. But they were arguing over this.
Yeah.
And I think that we need to, again, it's part of the behavior change.
That's right.
We need to reorient our consciousness and our identity as a nation, as a people. And government must have its priorities. Once you decide that this is my priority and you invest in it, and once it's a priority, you invest in it. And once you invest in that, very soon you begin to reap the results.
Right.
I mean, can you imagine if as a country we decide that for the next 4 years we are going to invest heavily in water and sanitation?
Right.
I can assure you that after the 4 years, very little will be seen of cholera, diarrhea, and all those water and sanitation related diseases because they will transform the lives of people.
That's right.
And so we need to do that. I mean, I think we should be, we shouldn't be afraid to take such decisions.
Right.
Because eventually, I mean, they will come with good dividends.
I have heard of a story from a friend, a medical doctor,
yes,
who came one day in tears. What was the issue? He was performing a surgery and then the water went off. And so they lost the person, you know, as a result of that. And I'm sure there are lots of families that can, you know, talk about such situations. And this talks about the importance of water. It talks about how important we need water. And for me, when this cholera outbreak came, I honestly couldn't believe that in this modern time.
Yes, I mean, we should be talking about other things.
When we should be talking about other things, we are here talking about cholera.
Yes, which is so preventable.
Very, very preventable.
Safe
so
drinking
easy
water,
to
improve
prevent.
sanitation, hygiene.
And that is all we need.
That's all you need. Cost-effective, very, very safe, and it doesn't cost you anything
To do, yeah.
to do.
Yeah.
And yet,
Yeah.
we sit down and allow people to get cholera. I visited Adan, Dan East and West districts. November, you know, November is World Toilet Day, November 19.
Okay.
And so we went there with a group of journalists, the Ghana Wash Journalist Network. We went to do an assessment of why the cholera outbreak in the districts. And we were in no doubt. We were left in no doubt why there was a cholera outbreak.
Wow.
People defecating the open anywhere. I mean, you won't get 5% of households having toilet facilities.
What?
And once that happens, this one is not rocket science.
It will just happen.
It will happen. Yes.
That's the
The outbreak
repercussion. That's the,
come. People are not washing their hands with soap and the running water. They eat when they have contaminated their hands and all that. All these things.
So what really happens to our law enforcers? Because, see, as human as we are, just like you said, if you leave the average human being, they will do whatever they want.
Sure.
But you see, the effect of it is that whatever they will do, it will not only affect them.
Yes.
It will affect even the innocent one sitting somewhere.
Perfect.
So that's the reason why we need law enforcers. And fortunately, Ghana, we do have them, the institutions.
But
we have the laws.
The partisanship has also crept into
that.
the enforcement.
I believe. I agree.
I mean, there are times when environmental health officers will arrest people who offend the law in terms of sanitation.
Yeah.
And then you can be sure somebody will call them and say release them.
And
let
then
them go.
when you leave them or you release them, what you've done is that you've empowered them to go and do it again, and even do it more.
Yes, and so that must also change. And I'm praying for the day that we'll have that. I mean, that change. I am saying that, for example,
yeah,
if the president, for example, decides that I'm giving a directive to all my appointees, particularly the metropolitan, municipal, and district chief executives, and I say, yes, from today, take steps to end open defecation in your jurisdiction. Develop a plan and implement it. By this year, open defecation should be over in your jurisdiction.
Right.
By this deadline, all households in your district must have access to toilet facilities. I don't think cholera will be able to survive.
And that shouldn't be difficult to do.
It shouldn't. And so
that
once
shouldn't be
you
difficult
give
to
that
do.
directive,
Yes.
At least people will be
leadership by example.
Yes.
When the leader is
and
saying moving this,
I'm waiting for that day when we'll have that. I'm sure we can have it.
We pray so.
Yes.
Let me quickly bring in some of the viewers who have sent in a number of messages. Some I may skip because it is very lengthy, but this one says from Larry Kenneth. Good evening, Mr. Wilson. I was shocked when I heard Ambassador Sampi Yale's death. I couldn't believe it. May his soul rest in peace. Okay. This one says, Yakubu, this is more than thesis. Yakubu from Abosokan, thank you so much for the message. It's very long. Try and summarize it so we can get to others. But your conclusion says, let's work together to address these pressing issues and create a healthier, more sustainable future for all Ghanaians. Thank you. Okay. Good evening, Mr. Wilson. My name is Joseph Lamte. I believe the education must be more, and that includes the schools from nursery up to the senior high school. The laws must also be enforced, and anyone who faults should be arrested to serve as a warning to others. And that is what we've been talking about.
Perfectly, yes.
Good evening, Mr. Wilson. I think our policies are not also helping, but the main problems are managerial problems and behavioral problems. Because we Ghanaians have some negative attitude towards the environment, because we have some dustbins in some parts of the country, but still, you will see people throwing things around. We need to change. If not, change will surely change us.
But can you believe that?
Husseini, yeah, from Sefi.
Can you believe there are places where you place? Because I remember the Ministry of Sanitation and Water Resources decided to place some dustbins in vantage points or advantage points, and they were stolen.
I agree.
Why would somebody think about stealing a dustbin?
Yeah. So when I even made reference to Kigali,
yes,
it came into my mind that, it is not as if we've not tried practicing same in Ghana.
Good.
But we have. But just that, it got to a stage where we were told that individuals will bring their rubbish from the home, bring it deliberately to come and dump it, in the dustbin that has been provided for pedestrians on the streets. Others too came up, and the report was that the dustbin itself was stolen. Indeed, the others that also came was that the law enforcers or the sanitation ministry or the appropriate agency failed to empty the dustbins on time. So there are so many issues that comes around it. Very well. This one says, good evening, Mr. Wilson. Please, I posted a video of a man pouring rubbish into a running rain, and I believe you saw it. Okay, I'm sure my producers will look at it. Please, there must be a law to enforce with a heavy fine, imprisonment for 3 months, or pay a big sum for the jail term, or send you to farm for the state for 6 months with your job still kept for you, but you lose half of your pay to the state until you are done serving the nation. Well, this is an interesting one. You didn't add your name, but this is really an interesting one. This one says, good evening, Mr. Wilson. We are failing to acknowledge the environmental health units in the MMDAs, which is why sanitation and hygiene issues are not solved. Let's invest in environmental health officers in the country. They have experts to help us overcome sanitation and hygiene issues. There's a lot to say. Thank you. You didn't add your name.
This is a fantastic point. I mean, across all the MMDAs,
yes,
the environmental health officers are key when it comes to improved sanitation. Unfortunately, they are the least recognized. They are the least. So, for example, you can have an environmental health officer without even a desk at the assembly. And if they have a desk, they don't have any laptop or even a desktop.
And they are being paid.
Oh yes.
Every month.
And they are expected to work.
And they're expected to work.
There's no motorbike. They don't have access to vehicles. There's no fuel. The no fuel syndrome is everywhere.
It's worse.
So how do you expect such a person to ensure improved sanitation in their, jurisdiction? So the people who matter, who should be empowered, who should be resourced, and who should be supported to do their work, I don't think we are supporting them at all. And it's a good point that he raised.
Yeah.
These are the people we should be resourcing. At least let every environmental health officer have access to a means of transport, even if it's a motorbike, and fueled, so they can go around to discharge their duties. But without that, it's difficult to enforce anything.
Do you think limiting this to the operations of our MMDAs, do you think we have failed as a country?
Yes and no. No, in the sense that we have been able to put in place powerful structures. The MMDA decentralization system is one of the best.
It's the best,
in the
actually,
world.
yes.
Yes. Unfortunately, we have decentralized functions without decentralizing resources. And so we continue to keep the resources here. And I'm happy that government says that now the assemblies are now going to get a chunk of the resources, going down there. That would be fantastic.
Directly to them.
Because without the resources, you can't expect any MMDA to improve sanitation.
That's right.
With what?
That's right.
And for some of them, it's difficult to even mobilize internally generated funds. Unlike Accra, Kumasi, Takoradi, Tamale, and a few places.
That's right, yeah.
And so it's important that we strengthen them, we empower them, and then we give them the resources to deliver. So that is where we have failed. Otherwise, I think we have done well with the system that we have put in place. Yeah.
I will come back to you as we wrap up because of our time, but just one or two messages. This one is coming from Hanin Ishak from Obuase, and she says, "Good evening. I love your conversation with your guests." This is Eva from Ablekuma North, and Eva says this is an interesting and insightful conversation. Thank you. This one says, "Good evening, Mr. Wilson. You are doing great. The guest has said it all. Ghana's presidents, ministers, MMDAs talk of sanitation with their mouth, but they don't prioritize it. We have environmental health officers who are well-trained, public health education, premises inspection, and law enforcement to prevent diseases through their mandated duties, but they are sidelined by the authorities." You didn't add your name. Good evening, Mr. Wilson. When you litter the environment, you immediately have to be arrested. The MMDAs must prioritize a by-force supply of dustbins and let them provide sanitation for their district rather than monopolize it to just one company. What will happen if each municipality has over 5 sanitation companies? I think that is also something that we need to look at.
Yes, but there are more to it than just meets the eye.
Right.
We are talking about capacity issues.
That's also true.
We are talking about issues of logistics, infrastructure, and all that. You need all that to be able to deliver. And I think that we can't put that blame on just one single company. Perhaps without that one single company, sanitation in Ghana would have been worse.
That's true.
I can tell you that one company that the person is referring to, is responsible for a number of the waste treatment facilities.
Okay.
And apart from that, solid waste, liquid waste treatment facility, even in all the 16 regions, partnering government to be able to put up waste treatment
So
facilities.
the capacity.
It will go a long way to help us.
So the issue is capacity.
It's about capacity.
Can't we, as a country, consciously decide to strengthen other?
Yes, I think we should. We should be able to strengthen the other service providers.
Exactly.
Because they also provide very useful service.
Very true.
And so if you don't support them in terms of the haulage, in terms of the taxes, and grant them some exemptions and all that, because sanitation is a public good.
Exactly.
And so no matter how small they are, even for the Abubuyas, they are delivering a service.
Sure.
And I think there should be a way of incentivizing these service providers to be able to deliver effectively on.
I agree. So this one is from Aaron Kofi Amejo, testing from Ho. Good evening, Mr. Wilson. Behavioral change, yes. But the issue is service provision. That is sanitation institutional structure, not reviewed since Kwame Nkrumah's household beings. Okay, since Kwame Nkrumah. The next one is household beings. They are too expensive. Third one, public place refuse containers, very, very inadequate. Fourth, staff strength inadequate. In case of liquid waste, we only need certificates of habitation. All we need, sanitation for professional and relevant institutions, but sanitation authority key. I'm not so clear on the message, but this one says, good evening.
But I think the sanitation authority is talking about has to do with the institutional arrangement where I said, apart from the ministry,
exactly,
we didn't have any operational agency.
Sure.
The authority was coming to sanitize the space, ensure standardization, regulation, research, development, resource mobilization, and all that to ensure that sanitation is really delivered, adequately. And so we really need that operational agency, whether it's an authority or service or an agency. I don't think it matters so much. All we need is that agency. I
think we really do need it. And I'm not very sure whether the current government had it in their manifesto.
If they didn't have it, it's time to think about it.
Honestly, I think we should.
Because when you go to Ministry of Health, and I say that is my favorite ministry in terms of how structures work. From the ministry, they have Ghana Health Service.
Exactly.
Ghana Health Service has so many institutions.
Exactly.
They even have the blood authority, ambulance authority, health insurance authority. They have so many, and so things are moving well. But you can't leave sanitation to just a ministry and the MMDAs. No,
it doesn't work that way. It won't even work. Good evening, Mr. Wilson. Indeed, I'm enjoying the show. Very educative and informative as well. I side with the host. For stating and making emphasis on, so it's rather I side with the guest, that's Mr. Ahin, for stating and making emphasis on behavioral change. Indeed, all what we need as a nation to be self-reliant. Ghana is blessed to have all. However, our attitude is what is making it look like we don't have anything in this country. We actually need to first change our behavior. Then sanitation issues will be the thing of the past. And this is from Shraj Kambonoba Salifu from Tanoso in Techiman. Good evening, and this will surely be my last one because of time. Good evening, Mr. Wilson. Ghana cannot prioritize sanitation because we are grappling to have pure drinking water, and so on. Until we are able to turn our waste into productive venture, it will always be seen as wasteful endeavor, draining the country's purse instead of curbing diseases and giving healthy life. And this is Muniru ARB from WA. And Mr. Ahin, I will end on this one. Sanitation, waste, water, hygiene. You go to other countries and they see it as money.
It's money. It's money.
Why do we see it as waste and it has even become a burden on us?
I went to one of these international agencies and they had this boldly written. It is a waste to waste waste. And I said that is profound. It's a waste to waste.
Yeah.
Because waste is now a resource.
Exactly.
Have you been to the Lavender Hill area? Now there are companies, the Mudok plant, waiting to receive that matter.
That's right.
To treat into a resource for money.
For money, yeah.
So why do we sit down and feel as if sanitation is something we shouldn't even talk about. It's a resource, and it's something that we should capitalize on.
I agree.
There are countries that have made it because of their
and China is a typical example.
If you are even going far,
right?
I mean, come to Kigali,
Rwanda. It is, yeah.
You can't even drop a chewing gum, a wrap of a chewing gum. You can't drop it. In Singapore, you can't spit. You'll be charged.
Exactly.
And so here it's like everything goes. We allow too many things. And I think that our sanitation and hygiene subsector needs a reset. And I think that government should help us do this reset. Let's give the MMDAs and all the appointees key performance indicators. You do A, B, C, D, ensure sanitation improves. If you are unable to do that, you are out.
You are out.
I mean, once we begin to do that, people will take us very serious. Apart from that, I think that we need to reposition water, sanitation, and hygiene as a key driver of national development.
Do you think with all this, we haven't seen that, with all this that we've talked about, would it have been prudent for us to still have a single ministry in charge of sanitation?
That is ideal. I mean, all over the world, even for the sustainable development goals, you know that they are together, water and sanitation. It's always good to have them together because of issues of coordination, harmonization, resource mobilization, planning, and a whole lot. There are benefits. Of course, as a citizen, I can also understand why that change has come to pass. Because we fail to support the ministry with the necessary institutional arrangement to deliver on sanitation especially. And so people say, why do you have a Ministry of Sanitation? And we see Bola all over. So it means that they were thinking that sanitation has failed or the new arrangement failed. So let's see how this will go. For me, there is an opportunity in there because now sanitation is closer to the MMDs.
And that's very important. They are the implementers,
the MMDCs to improve on sanitation with a directive. Hitherto, the Minister for Sanitation and Water Resources couldn't tell an MMDC do this because they don't feel that they report to him. And so I am seeing an opportunity. And if you are able to implement it well, I'm sure sanitation should improve in this era that we are entering into.
Your last words and any recommendations?
Again, I would say that government has something to benefit from if it improves on sanitation. And so let's prioritize improved sanitation, hygiene, and water service delivery. Let's invest adequately into it because the dividends will soon be reaped. Cholera will be a thing of the past, and then we'll have so much to save for other development, activities. Apart from that, I also want to encourage citizens to change our behavior. Behavior change is required. No amount of investment can transform sanitation the way we want it if we don't change our behaviors. And so let's have a reawakening of our consciousness and ensure that we improve on sanitation wherever we are. And once we do that, we'll have our children living long, we'll have productivity increasing, and then socio-economic development will be achieved. Thank you.
Mr. Aye, thank you so much. This is such a great conversation, Thank you so much. And we believe this will not be the last time. We'll be having such opportunities to educate ourselves, particularly our viewers, as we continue to transform the future of this country. Viewers, this is where time will allow us. And as I indicated earlier, I believe you've agreed with me absolutely that Mr. Ahe is indeed the right person for this conversation. A lot of things that we can reflect on and think about and know that sanitation, water, hygiene is such an important area, and yet most often we ignore and we don't think about, forgetting that it has a direct correlation to and with our existence, even as human beings. All too soon, this is where time will allow us. I want to say a big thank you to you for also being part of this episode. Next week, same time, we are going to have another insightful episode. And let me also add that for the very first time, we've had a guest coming to the show or to the studio with a wonderful gift for us. And that includes you, the viewer, too. So, Mr. Ayin, thanks again for the wonderful gift that you brought to us. So we'll meet again next week. My name is Emmanuel, Engineer, and all I can say for now is good night.